I'd like to answer some questions about a condition called leaky gut. Leaky gut syndrome is a bit of a misnomer because it sounds like something is going out into the gut, and it's actually the opposite. A leaky gut is a permeable gut where too much protein can be absorbed from the gut into the bloodstream, and this tends to be due to a food allergy. As an example, one of the more common food intolerances is to gluten or wheat or bread. So as we digest gluten and wheat, it turns into a protein called gliadin, and when gliadin binds to the receptors on the outside of an intestinal cell, that can cause an intestinal cell to produce a protein called zonulin. And zonulin, when that's secreted into the lumen of the gut, that can cause breakdown of another protein called occludin. And occludin is the protein that is responsible for the tight junctions in between the intestinal cells. So when occludin breaks down, then actual wheat and gliadin and other large protein molecules can get from the intestine into the bloodstream, and that can cause an immune response. And a lot of times this can lead to autoimmune diseases like autoimmune thyroiditis, Hashimoto thyroiditis, and other autoimmune conditions like rheumatoid arthritis, chronic fatigue. And most physicians just don't test for this. So in our practice, we do a FIT 132 test or a food intolerance test to 132 different common food allergens to see if you're sensitive to certain foods, because sometimes chronic fatigue, not feeling well, constipation, and other esoteric conditions like autoimmune diseases can be due to things like food intolerances, and the only way to know if you have it is to test for it. A food intolerance test is a simple blood test. It's a finger prick blood test. We send this to your house, or we do it in the office for you, and it can tend to shed a lot of light insofar as your diet and what foods you should avoid and what foods are okay to eat. And by knowing that, it can just lead to a markedly improved quality of life with decreased morbidity and improvement of many chronic disease cases. So I hope this was helpful, and thanks for listening.